Hello, Dr. Rezaul.
Yeah,
You can start your presentation now. Is the
okay.
slides visible for you?
Can you see me? Hello?
Yes, we
Yeah,
can.
can I start now?
Yes, yes, yes.
The lipid profile of coronary heart disease is a prospective observational study that is conducted in Abdur Medical College, Dinajpur, Bangladesh. I am Dr. Rezaul Alom, Assistant Professor of Cardiology in Abdur Medical College, Dinajpur, Bangladesh, presenting the papers. This is my beautiful country. This is the sceneries of my beautiful country, and this is again the sceneries of my beautiful country. This is start. The abstract. Coronary heart disease remains the major cause of mortality coronary heart disease in most of the Western world and as well as the Asian countries of the world. But we do have little data on the relation between coronary heart disease and the lipid profile as well. The aim of my study. The aim of this study was to assess abnormal lipid levels and their association with coronary heart disease. The method, a comparative observational study was conducted at the Department of Cardiology in Abdur Medical College, Dinajpur, Bangladesh, from January 2019 to December 2019. Properly written consent was taken from all the participants before starting the main part of the investigations. Obeying the inclusion and exclusion criteria of the study, a total 131 participants were penalized as the study population. Among case group formed with 90 patients who had coronary heart disease and 41 healthy people, control group was formed. All the necessary data was collected, analyzed, and disseminated by several programs of MS Office Word and SPSS version 23. The study was conducted with 90 case group participants and 41 control group participants. Among the case group, 78% were male and 22% were female. And the study showed serum total cholesterol and the HDL cholesterol concentration were significant in all the age groups, and the p-value was less than 0.001 in every age group. Whereas the triglyceride concentration was significant between the case and the control group as well in 41 to 50 years and 51 to 60 years age group with the p-value less than 0.001. But in the age group more than 60 years, we didn't find any significant correlation, and their p-value was 0.478, which is insignificant. And the LDL cholesterol concentration between the groups showed significant correlation between the case and the control groups in the age groups between the age 41 to 50 years and the 51 to 60 years, where the p-value found less than 0.001 and 0.002 respectively. But in the age groups more than 60 years, we didn't find any significant correlations, where the p-value was 0.515. In regression analysis between the male and female participants of the case groups based on age, we found the p-value was 0.242. So there had not been any significant correlation in this respect. The conclusions. In this study, it was found that total cholesterol, LDL cholesterol, and triglyceride were significantly higher, and HDL cholesterol was significantly lower in the coronary heart disease patient. Introductions. The lipid profile means the pattern of lipids in the blood. It contains total cholesterol, triglyceride, LDL cholesterol, and HDL cholesterol. In general, the lipid profile tests are used as indicator of whether someone is likely to have heart attack or a strong stroke due to the blockage of the arteries or atherosclerosis or hardening of the arteries. For a person of 68 kg, the typical total blood cholesterol is about 1 gram per day. Increased level of total cholesterol, triglyceride, and LDL cholesterol are found to be associated with higher risk of coronary heart disease and a stroke, whereas HDL cholesterol are found to be inversely associated with the risk of coronary heart disease. Dyslipidemia is one of the primary causes of coronary artery disease. American Heart Association guidelines prescribes the desirable level of lipids of lipid profile as total cholesterol should be below 200 milligram per TL, triglyceride should be below 200 milligram per dl, and HDL cholesterol concentration in case of male, it should be more than 50 milligram per dl, and in case of female, it should be more than 40 milligram per dl, and the LDL cholesterol concentration should be less than 130 milligram per dl. But in a patient with coronary heart disease, the desirable level of the lipid profile should be with the target, the total cholesterol that should be below 200 milligram per dl, and the triglyceride levels, it should be below 150 milligram per dl, and HDL cholesterol concentration. In case of male, the target is more than 50 milligram per dl, and the female more than 40 milligram per dl. Whereas in the LDL cholesterol concentration, it should be below 100 milligram per dl. Another study also found that the higher percentage of female, 46.8% compared to the male, 34.9% have an optimal level of LDL cholesterol concentration less than 100 milligram per dl. About 20% of the male had very high level of LDL cholesterol concentration, which is about more than 160 milligram per dl, whereas while it was noted in only 6.7% of the female were the patients. The human body cholesterol is important for cell membrane and synthesis of sex hormone like estrogen, progesterone, adrenal hormone like aldosterone and cortisol. It also helps to synthesize vitamin D in the skin, thus helps to maintain bone density by using calcium. Many previous studies on lipid profile have been conducted in some of the famous institutions in Bangladesh. Among those institutions and hospitals, NICBD in Dhaka, ICDDRB in Dhaka, and BSMM in Dhaka are some of the noticeable ones. Although there have been many studies conducted on the lipid profile of coronary heart disease patients in Bangladesh, there are some variations in the findings of those studies. For this reason, we conducted this study to acquire some more specific information and the correlation between lipid profile and coronary heart disease patients in Bangladesh. The methods. The comparative observational study was conducted at the Department of Cardiology in Abdur Medical College, Dinajpur, Bangladesh, during the period of from January 2019 to December 2019. Properly written consent was taken from all the participants before starting main part of the investigations. Initial sample size was determined to be 200 participants with 100 cases and 100 control patients. Due to time restraint, inclusion and exclusion criteria of this study, the willingness of the patients to participate in the study, a total of 131 participants were finalized as the study population. Among them, the case group was formed with using 90 patients who had coronary heart disease, and the control group was formed with 41 healthy persons. Convenient sampling method was used to selection of the participants. The age of the participants was 41 years and above, and all the demographic and risk factor related informations were collected from the available patients' records available in the hospital and by the data collection sheets provided to the participants containing information of the patients. The patient of case group number 90 were selected with a history of angina and or surviving myocardial infarction with or without diabetes mellitus and hypertension, and admitted and diagnosed in the coronary care unit of mentioned hospital. According to the exclusion criteria of the disease of the study, coronary heart disease cases with liver disease, renal disease, and thyroid disorders were excluded. Clinically, healthy subjects aged above 41 years who served as population-based control were selected as the participant of the control group. Estimation of the lipid profile, total cholesterol, triglyceride, LDL cholesterol, and HDL cholesterol are done in both the case group and the control group. All the necessary data were collected, analyzed, and disseminated by several programs of MS Office and SPSS version 23. Inclusion criteria of those patients. In case of case group, we take those patients aged more than 41 years and above, and a patient with history of angina or myocardial infarction, patient admitted at the CCU of the study hospital. And the contributor was selected by the age more than 41 years and above, and following to participate in the study, willing to participate in the study, and clinically healthy subjects, and willing to share the necessary information that we do seek. And the exclusion criteria of the case group, the patients who are less than 41 years of age, they are excluded. patients with liver disease, renal disease, and thyroid disorders, and mentally unstable patients are excluded from the study. And the control group, who are less than 41 years, mentally unstable, and clinically unhealthy, and unable to share the necessary information, they are excluded from the study group. The result. The study was conducted with 90 case group participants and 41 control group participants. Among the case group, 70 were male, which was 78%, and 20 were female, which was 22%. Among the male participants of the case group, 44.29%, 37.71%, and the rest 20% were from age group 51 to 60, 41 to 50, and more than 60 years age group respectively. Here we see the most population within the 41 to 50, 51 to 60 years. On the other hand, among the female participants of the case group, 45%, 30%, and the rest 25% were from 51 to 60, 41 to 50, and more than 60 years age group respectively. Here again, most of the population remains within 51 to 60 years. In regression analysis between the male and female participants of the case group, based on the age, we found the p-value was 0.242. So there had not been any significant correlations. The study showed both the serum total cholesterol and HDL concentrations are significant in all the age groups, and the p-value was less than 0.001 in every age group. Whereas the triglyceride concentration was significant between the case and the control group in 41 to 50 and 51 to 60 years age group, where the p-value is less than 0.001. But in the age group more than 60 years, we didn't find any significant correlations, and there the p-value was 0.478. LDL concentration between groups showed significant correlation between case and control group in the age groups between 41 to 50 and the 51 to 60 years, whereas p-value found less than 0.001 and 0.002 respectively. But in the age group more than 60 years, we didn't find any significant correlations, but the p-value was 0.515. Gender distribution of the participant of the case group. I will say the out of 90 patients, male were 70 and female were 22. The most of the participants were male. Age distribution among the participants of the case group. Here we see between the age of 41 to 50 years, the number of male was 25 and the number of female was 6, and both of them constitute 34%. In case between the age of 51 to 60 years, the number of the male is 31 and the female 9, and they are considering about 44%. And the age more than 60 years, the number of male participants were 14 and number of female was more than 5. This is about 21%. Here we see the most of the population remains within the age of 51 to 60 years. The age distribution of total cholesterol concentration between the groups. Here we see the total cholesterol levels between the age of 41 to 50 years. This is in case of case, it is 197, whereas in case of control, it is 168, which is significant. The p-value is less than 0.001. Between the age group 51 to 60 years and the total cholesterol level, in case of case group 207, whereas the control group 118. This is even significant because the p-value is 0.001 less than. And in case of 60 years age group, the total cholesterol level is 263, and whereas the control group having 193, and the p-value is 0.001 less than. So this is again significant. And the age-wise distribution of triglyceride concentration between the groups. Here we see out of 131 patients, the age group 90, where the 41 to 50 years age group, the triglyceride concentration is 167, whereas the control group having 109. This is the p-value having less than 0.001. This is significant. And between the age group 51 to 60 years, the triglyceride concentration is again 210, whereas the control group having 125, and the p-value is here less than 0.001. This is again significant. And in the age group more than 60 years, the total triglyceride concentration is about 152, whereas in case of control group, it is 157. Here the p-value is 0.4783. This is insignificant. Age-wise distribution of HDL concentration between the groups. Here we see that between the age of 41 to 50 years, the HDL concentration is 40 in case of case group, and in case of control group, it is 50, and the p-value is here less than 0.001. This is significant. And the age group between 51 to 60 years, the HDL concentration is again, in case of case, it is 47. In case of control, it is 75. And the p-value is less than 0.001. So this is again significant. And in the age group, more than 60 years, here we see the HDL concentration is 43 in case of case, and in case of control group, it is about 86. This is having the significant, that is the p-value is less than 0.001. Now we see the age-wise distribution of LDL concentration between the groups. Here we see the between the age of 41 to 50 years, the LDL concentration is 99 in case of case group. In case of control group, it is about 75. The p-value is here is again less than 0.001. This is significant. And in between the age group 51 to 60 years, here the LDL concentration is 104, whereas the control group having 90, and the p-value is less than 0.001. This is again significant. And the age more than 60 years, here the LDL concentration, that is in case of case group 107, and in case of control group, it is 117. This is the p-value having 0.515. This is insignificant. Discussions. Depending on the severity of the coronary artery narrowing, myocardial responses are divided into chest pain, acute myocardial infarction, sudden cardiac death, and chronic ischemic heart disease. The most common risk factor of coronary heart disease are hypertension, smoking, obesity, dyslipidemia, diabetes mellitus, stress, gender, and age distribution. There are also high level of total cholesterol, triglyceride, LDL cholesterol, very VLDL, and low level of HDL cholesterol, which are considered as the most common modifiable risk factor of coronary heart disease. Affiliation and Framingham study demonstrated that elevated levels of plasma cholesterol found in the patient with coronary heart disease. Among male participants of case group, 44.29%, 35.71%, and the rest 20% are from 51 to 60, 41 to 50, and more than 60 years. On the other hand, and among the female participants of the case group, 45%, 30%, and the rest 25% were from 51 to 60, 41 to 50, and more than 60 years age, respectively. So middle age group may be considered as the potential risk factors. Atherosclerotic is not clinically evident until middle age or later when the arterial lesions participate in organ injury. This is here you see the middle age group are more prone to develop coronary heart disease with the lipid abnormalities. Incidence of myocardial infarction increases 5 times between the age ranging from 40 to 60 years. In addition, men are much prone to develop atherosclerosis than women. Myocardial infarction, coronary heart disease, and atherosclerosis are uncommon in premenopausal women. It is theorized that the incidence of atherosclerosis-related disease increases due to a decrease in natural estrogen level in postmenopausal period. Epidemiological studies have linked the intake of high levels of dietary fat rich in cholesterol and saturated fat with increase in plasma cholesterol level. Therefore, restriction of saturated fat and the cholesterol is the cornerstone of dietary therapy to lower down the elevated blood cholesterol levels. Framingham study has demonstrated that increased level of total cholesterol, triglyceride, and LDL cholesterol, and decreased level of HDL cholesterol are independently or combinedly related to coronary artery disease and MI. In our study, age-wise distribution of both the serum total cholesterol, HDL concentration are significant in all age groups, and the p-value was less than 0.001 in every age group, whereas triglyceride concentration was significant between the case and control group in 41 to 50 and 51 to 60 years age group with p-value less than 0.001, but in the age group more than 60 years, we didn't find any significant correlations, and their p-value was 0.478. On the other hand, age-wise distribution of LDL concentration between age groups showed significant correlation between case and control group in the age group between 41 to 50 and 51 to 60, whereas p-value were found less than 0.001 and 0.002 respectively. But in the age groups more than 60 years, we did not find any significant correlations, but the p-value was 0.515. Clinical studies based on extensive literature support the inverse relationship between HDL concentration and atherosclerosis, with its consequent coronary heart disease and a stroke. In line with these findings, our study demonstrated a significant decrease in the HDL concentration in patients with coronary heart disease when compared to the control group patients. National Cholesterol Education Program recommends an LDL cholesterol goal should be less than 100 milligrams per TL in patients with established coronary heart disease and those who are coronary heart disease equivalent. Aggressive LDL cholesterol concentration reduction is associated with less atherosclerotic progression, lower rates of revascularization, and fewer ischemic events compared with the moderate LDL concentration reduction or conventional treatment. Conclusions. In this study, it was found that the total cholesterol, triglyceride, and LDL concentration were significantly higher in coronary heart disease patients, and HDL cholesterol concentration was significantly lower in those patients with coronary heart disease. These findings may be helpful in the treatment arena of coronary heart disease and similar further studies. Recommendation. My recommendation is this was a single-centered study with a small size sample, so the findings of this study may not reflect the exact scenario of the whole country. For getting more specific information, would like to recommend conducting more studies in several places with a large size sample. This is the picture of my Bangladesh, it's a good country.